We've been focused this week on making sure our transition plan is in place and as seamless as possible. And let me be unequivocally clear, we have a phenomenal, fantastic, bright, brilliant team within public health services and health and human services and other arms of the government who will continue to execute the work that we have put into place over the last 18 to 20 months. I have no pause or concerns about the team's ability to do so, and it has been an extreme honor and a privilege to work alongside with them in partnership over this last year and a half and working with our community residents to keep them safe. I also want to say something related to working with the county executive and listening to some of the transcripts last week and reading some of the news articles. I personally appreciate significantly the opportunity to work with an elected official who has not been afraid to listen to science and clinical advice. I know that my fellow colleagues in other parts of the state, the region, and the country have not had that opportunity. And I want to publicly thank him for giving the space to allow for those messages to be heard, to help advise policy and advocate for those policies, because there have been a number of times where we have moved against the grain. We have caught a lot of flack and stress for that. But the data has proven that those decisions have helped keep folks safe, which is ultimately, at the end of the day, the goal that all of us have had throughout the pandemic. I will be pivoting and transitioning to a next chapter and a new chapter, which will be announced by the end of the week. So I can't go into great detail about that today, other than to say that it is an opportunity that will allow me to continue to be committed to what I have tried to move through my career focused on, which is improving access to care and closing gaps in health outcomes for all members of our community, particularly those who are most vulnerable.
We will begin a search. And that should start pretty shortly. We want to fill this as quickly as possible. I expect other people to apply. I've already been contacted by at least one person who'd like to apply. So we'll do the search. This is, I think it's not solely the county's appointment. We do the search, we come up with candidates, and then we send them to the state. And I had a meeting with the Secretary of Health, and I just made it clear that that what we're looking for is somebody who will be independent and will not give us political advice, but will give us the best medical advice. And that if it means standing up to the governor, who's this person's other boss, that I'm looking for somebody who has the courage to stand up and tell us the right thing to do and not tamper down the right thing to do because of political considerations. There's no way that we would have gotten where we did if we had a health officer who was looking over his shoulder at what the governor wanted him to do. And the governor's not a health official. So I want somebody who has the knowledge and courage of convictions that Dr. Gayles is able to demonstrate, so that we don't ever wind up in the situation that's happened across the country.
Two things. The first one is, yes, we've received a lot of backlash for what we've done, but I wouldn't change anything that we've done. I stand proud. I stand proud with our team of everything that we've done. We've had to make tough decisions with limited information, limited resources, and unfortunately, politics has been injected into that discussion, which has made it very difficult for some folks to understand the value of the work that we have done across the board. And again, not just here in Montgomery County, across the state, the region, and the country. And I'm hopeful that if we ever face a pandemic again, or any other significant public health issue, that we won't have to deal with that type of politics and we'll be able to respond together, regardless of demographic group, geographic location, party affiliation, and so forth. Health decisions and scientific decisions and medical decisions are not based upon what are politically popular. And as a public health practitioner, as a clinician, I think of in practicing medicine, when we make decisions based upon the training we have and the knowledge available to make sure that the patient is having the best outcome possible. And that's what we've been asked to do. And that's what I feel strongly we have done over the time. And I'm proud of the work and proud of the work of myself and the team in getting that through. So with that said, certainly, you do get, it's been chronicled, some of the stuff and the feedback we've received. But I quoted in our meeting, our team meeting the other day, I got the artist wrong. I said it was Katy Perry, and they corrected me and said it was Taylor Swift. But shake the haters off, quite frankly. And we will continue to stand on principle and do the work that we've been trained to do, and, based upon the expertise we have. Now, that said, I was presented with an opportunity, was approached about an opportunity that leveraged my interest and passions, many of which we have put forward in our COVID response and the work that we've been doing in the county, not only in health, but in other areas related to equity, social justice, and access to care. And was presented with just a phenomenal opportunity that, quite frankly, I could not say no to. And I think that once it is, and I'm not trying to be cagey, it's just I'm respecting the entity's announcement to come. But I think once you find out what it is and it's made public, it will make perfect sense. And it's entirely consistent with, again, what I have hoped to have conveyed in terms of my mission and my professional career, which is to improve access for all folks, particularly those who are most vulnerable.
If you find our videos useful to you, please like, share, and subscribe to our channel.